A traumatic brain injury occurs when an external force traumatically injures the brain. Common causes include various kinds of accidents, falls, blunt blows to the head, automobile accidents, and abuse and interpersonal violence. There are two types of traumatic brain injuries, penetrating and non-penetrating. Penetrating is an open head injury which involves an open wound to the head from a foreign object, in which the skull is often fractured or perforated and the meninges are torn. A non-penetrating or closed head injury is marked by brain damage due to indirect impact without the entry of any foreign object into the brain. The skull may or may not be damaged, but there is no penetration of the meninges.
Acceleration injuries are caused when the moving head hits a stationary object. If the force is strong enough, it can cause a contusion at the site of impact, which is the coup, and the opposite side of the skull, causing an additional contusion, contracoup. This is what acceleration looks like.
There can be different types of acceleration causing different injuries. The first is linear, which is a hit at midline. In other words, a person gets hit in the middle of his or her head. The second type is angular, which is a striking force off midline with head rotation.
Deceleration is another type of non-penetrating TBI. It is caused by a muscle restraint in which a person attempts to stop, such as a whiplash injury.
So Stan, man, how about that neuro test? How'd you do? Oh, it left you speechless? Dude, I completely understand. It's tough. Oh no!
The third type of non-penetrating brain injury is non-acceleration. It's an injury caused by a moving object hitting a restrained head, and therefore no acceleration or deceleration of the brain occurs within the skull.
Symptoms. Depending on the type and location of the injury, the person's symptoms may include altered consciousness, confusion and disorientation, memory compromise, amnesia, speech and language compromise, dysphagia, behavioral changes such as feeling of depression, irritability, and emotional disturbances, fatigue, headaches, visual problems, poor attention and concentration, sleep disturbances, and dizziness and loss of balance.
Prevention. Always use protection.
Use a seatbelt.
Wear a helmet.
And never jump off a pier.